for continuing to join us for an in-depth conversation regarding the Midlothian Free Clinic. Doctor, we left off talking about the impact and the importance of the care that you provide and the impact it has on the healthcare providers in the community.
Sure. The facility, the clinic has been set up to help unload services that would otherwise go to the emergency rooms in the community. And that's very expensive care and very high-level care that needs to happen in the emergency rooms. From the clinic standpoint, we provide primary care services. So just like any family physician or internist in the community that would do general primary care to the community, that's what we do. By providing that care, we basically divert people from having to go to the emergency room for much more expensive care for the same services. And that's been a big part of what we do.
How are you staffed, Carol?
We are staffed by volunteers. We have a group of doctors, Dr. Albany included, who, and I should add nurse practitioners in there that volunteer their time. We also have nurses, a group of nurses who volunteer their time. We also have a social worker who comes, and she is the one that makes the calls for our patients and does input on them. And we have a respiratory therapist that comes every clinic and checks the charts to see if anybody needs any type of respiratory care.
How are you funded?
We are funded mainly by donations and by grants.
This is a big part of your budget.
Correct. If I could add to what Carol had said about staffing, we provide a variety of services. Aside from social services, we have physical therapy that's been a very big part of our program. And we have with respiratory therapy, and we also have diabetes education, which we'll be addressing a bit later as well. Dietary, we've had an interaction with YSU, who's provided physical therapy assistance in our services to our clinic, as well as dietary services and social services as well. So that's all been a part of what we provide to people coming in for care.
There's a lot more going on than just saying Midlothian Free Clinic.
Correct.
Even though the name still says Midlothian, you're located now on Wick Avenue instead of on Midlothian.
And our brochures do say Midlothian Free Health Clinic on Wick.
Wick.
Yep.
Thank you, Carol. I thank you for joining when we return for in-depth conversation. Kathy Chapman is going to be joining the doctor and I for further discussion regarding the services provided. I'm Dee Crawford, Community Affairs Director, WKBN.
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.